have 7 minutes left, and we still have several questions. I'm going to open this one up for all of you, and I'm going to lump two of these questions together, so bear with me. Let's say a patient is on systemic therapy and they're getting their scans, right, to make sure that the treatment is working. And on these scans, you start to see small spots or nodules. And let's say this patient had early stage disease, and they underwent surgical resection up front. How do you know if these small spots or nodules are the cancer sort of slowly creeping and growing? How do you know if it's scar tissue? How do you know if it's something else entirely? So that's just for nodules. What about lymph nodes as well? Some mildly avid FDG lymph nodes. What do you guys do in this setting?
This is a patient who's had surgery, you said?
Yeah.
Regardless of which treatment they've had, I mean, ultimately, um, I think you want to look at the trajectory of multiple imaging studies over time. Something that was stable on and off systemic therapy was probably benign and is likely to remain benign. Something that appears that small little nodules that appear while the primary tumor decreases in size is likely going to be infectious or inflammatory. Lymph nodes are likely to look, all sorts of stuff happens after surgery. Lymph
Yeah.
nodes may look enlarged. Sometimes people have inflammatory changes after radiation. Ultimately, I think if someone has had a local therapy, you need to involve the clinician who performed that local therapy to see whether it's expected or not. But I think at the end of the day, it's following stuff over time and seeing what gets bigger, what gets smaller compared to other things. And lymph nodes are easy. You can do an EBIS and figure out if they're real or not.
Yeah, I totally agree. What's most important is the trend, right? I always tell my patients if a nodule shows up, is that it's important if it comes and sticks, or if it comes and stays and starts getting larger. This is where I would worry and try to biopsy that nodule. There is also an entity of like multifocal adenocarcinoma. We see that a lot. And these are patients who probably had nodules for years and years. Some nodules will start acting up, some nodules will stay, like silent or quiet for a very long period of time. And at least from what I've noticed, I don't know if there is strong evidence on that, but most of these patients have mutations in the KRAS pathway. So it's very important to keep that thing in mind that some nodules are just going to be there and not do anything. But what's more important is the trend.
Yeah, and I just want to add just very briefly, if that local therapy was radiation, it's important to correlate with prior radiotherapy fields. So that's when your radiation oncologist opinion is probably the most important because we know where and when and what dose. There's no way to overlap, at least at this time, radiation fields and delivery with the diagnostic imaging that is received in follow-up. I'm sure whoever comes up with that solution is going to charge a boatload of money for it, so it's not going to be available at most centers. So that's what I would say. I always say this all the time is I'm the quarterback of the lungs after we've pointed some radiation there.
All right, you heard it here first. The radiation oncologist is now the quarterback of cancer care here for this specific scenario.
Yes,
I
only after radiation, that's all, because we can correlate. Yeah, I just mean with follow-up imaging and preventing PET CTs from occurring because there's physical harms such as biopsy risks. There's
Yeah.
psychological harms. You still have cancer from a avid PET CT, and then there's cascade harms that can result from a PET CT too early, such as systemic therapy switch.
Yeah.
So that's what I mean. It's just about taking ownership of what we have done. That's really
I
it.
love that.
As a team, as a team.
Yeah.
The only other thing I would add about the lymph nodes is I do tend to ask patients about recent vaccinations because we do know that some of our vaccines will cause some of our lymph nodes to enlarge and also become FDG avid sometimes on our scans.
Yeah, thanks for adding that important point.